The Justice Community Opioid Innovation Network, or JCOIN, aims to improve how the criminal justice system responds to addiction. JCOIN brings together a national network of researchers and practitioners across justice and behavioral health settings. The vision of JCOIN is to ensure that every justice-involved individual with a substance use disorder has timely access to evidence-based treatment. Led by the National Institute on Drug Abuse, JCOIN is part of the NIH HEAL Initiative, a large-scale effort to address the opioid crisis led by the National Institutes of Health. JCOIN is organized around 5 goals. Number 1, research. JCOIN aims to generate new evidence about what works and how to implement these practices. JCOIN includes 13 research centers, each conducting large clinical trials, and 2 large resource centers that conduct complementary studies and provide supportive infrastructure. Each research center works with justice and health stakeholders to address gaps in opioid use disorder treatment and related services in a wide range of justice, health, and community settings, including jails, prisons, community corrections, problem-solving courts, and juvenile justice agencies. JCOIN's 13 clinical studies fall into 3 categories. State policy rollouts, which studies looking at what happens when states make comprehensive policy changes to improve access to treatment services. Linkage facilitation, studies that examine how people transition from justice settings to community care. And MOUD comparative effectiveness trials, which compare medications for opioid use disorder to find the most effective treatment for individuals in need. Several of these studies also include organizational implementation components, testing strategies to improve the availability and quality of treatment services. Together, the JCOIN studies span 117 counties across 28 states and will collect data on more than 40,000 justice-involved individuals. JCOIN's research includes a Massachusetts study on the implementation of a new law to expand the use of all 3 FDA-approved forms of medications for opioid use disorder, or MOUD, in 7 county jails across the state. JCOIN also includes 2 large studies that span 6 states, comparing the effectiveness of injectable medications to treat opioid use disorder for those coming home from jail, and a Kentucky study of telehealth and peer navigation for justice-involved women with opioid use disorder as they transition from jail to the community. In addition to the clinical studies, 2 large resource centers conduct complementary research and provide supportive infrastructure for JCOIN. The Coordination and Translation Center, or CTC, and the Methodology and Advanced Analytics Resource Center, or MARC. The CTC provides outreach and mentorship to researchers and practitioners to increase capacity within the justice system, dissemination of products and key research findings, engagement with practitioners in the justice and health fields, and rapid turnaround innovative pilot studies, such as testing Niatex versus the ECHO model in a random control trial, a study on the effectiveness of dissemination efforts to the justice and health fields, and a study on the implementation of digital therapeutics for individuals with substance use disorders. The MARC provides data infrastructure and statistical and analytic expertise to support JCOIN studies and cross-site data harmonization. The MARC conducts national public opinion surveys about opioids and related topics and develops sophisticated simulation models, along with novel empirical research to understand changes in state policies and practices within the criminal justice system, and a national longitudinal survey of jails and prisons. Priority number 2, serve as a go-to resource. JCOIN's second goal is to become a go-to resource for researchers and practitioners. JCOIN is committed to making sure its research findings are widely shared, easy to find, and useful to non-academic audiences. Using a variety of media, from newsletters to webinars, podcasts, and short courses, to engage a wide range of stakeholders, and making user-friendly products and tools available to the widest possible audience. Priority number 3, build a network. JCOIN works to build a collaborative network of national impact, from the research teams and study sites, which include local and national partners, to a robust network of health and justice practitioners nationwide. Each research team has partnered with justice agencies and community health agencies in at least 5 communities, Every clinical trial is represented on the JCOIN Steering Committee by a researcher, a Justice Agency representative, and a Community Health Agency representative. By building a collaborative network, JCOIN ensures that the research is informed by and responsive to the needs of real-world problems. Priority number 4, building capacity. JCOIN supports new and emerging investigators through learning experiences to advance practice, or LEAP. The education program supports researchers and practitioners with training and mentoring to build research capacity within justice and health settings. The JCOIN Rapid Innovation Grant, or JRIG program, is a rapid funding mechanism to support small research grants, pilot studies, and local program evaluations focused on addressing addiction in justice-involved populations. JCOIN also offers on-demand technical assistance and online courses, webinars, and other resources for a wide range of audiences. Priority number 5, speed science to practice. JCOIN aims to shorten the time between the release of new research findings to their adoption in communities to help the millions of patients, families, and communities impacted by addiction. To accomplish this, JCOIN works to build relationships and linkages with practitioners and leaders in the health and justice fields. From the JCOIN Practitioner Board to the stakeholder network that includes 26 distinct audiences across justice system practitioners, healthcare, community services, state and local governments, and impacted individuals, and a national network of partners. JCOIN research hubs include the Brown University Hub, Chestnut Health Systems, Friends Research Institute, Indiana University School of Medicine, the Massachusetts Hub, New York State Psychiatric Institute, Columbia University Hub, New York University School of Medicine, Texas Christian University, the University of Chicago, University of Kentucky, George Mason University, and Yale University. For more information, visit www.jcoin-CTC.org.